and get started because we've got a great program planned for you this morning. So welcome. Welcome to the Household Water Treatment and Safe Storage Network annual meeting. This session is co-convened by the Network Secretariat, which includes the Water Institute at the University of North Carolina, the World Health Organization, and CAWST, the Center for Affordable Water and Sanitation Technology. I want to thank my collaborators who helped prepare this session for us today, Dr. Batsy Majuro from the WHO and Ko Tisan from the Water Institute. So why are we here? The Household Water Treatment and Safe Storage Network is a global coalition that promotes water quality initiatives, which include HWTS, as well as point of use technologies. Our efforts, of course, contribute towards Sustainable Development Goal 6.1. And one of the key criteria of that goal, very ambitious goal, is that any drinking water service that is considered safely managed, that water is free from contamination. And because of that criteria, the Joint Monitoring Program is now including estimates of drinking water quality in their reporting, which is a significant improvement from the MDGs, or the Millennium Development Goals. The most recent data tells us that globally, at least 2 billion people use a drinking water source contaminated with feces. And even the most recent JMP data from the Wash in Schools report, and I actually believe they have a session going on now, so I'd encourage everyone to maybe go watch the recording of that afterwards. They included a study from World Vision that looked at a survey of rural schools in sub-Saharan Africa, where 42% of rural schools that were using unimproved sources, 9% of schools that were using boreholes for their drinking water source, and 14% of schools that were using piped water supplies were using drinking water that was considered to be very high risk. So while we know this is a pervasive issue within homes, we know it also exists within schools, public institutions, healthcare facilities. So I certainly am risking this morning preaching or telling you something that you already know, but I do want to anchor us in terms of why this network exists and what challenge we're here to address. So this group focuses specifically on sharing research and practice to inform policy and to improve our practice. We want to be focusing on how water quality initiatives have the greatest potential to impact health and well-being. And this is really a broad collaboration across the sector. We have representatives from international development agencies, researchers, governments, civil society and NGOs, and of course, private sector actors. We are a free network, so if you're not already a member, we'll give you some information later in the session to join us. We would love to have you be part of that conversation to contribute your learnings and experience, as well as get real-time support when you're working on your programs and initiatives. So for our session today, we have a full hour and 15 minutes for you. We're going to quickly talk about the year in review, and then we'll move into a section where we talk about our HWTS, or water quality initiatives, in the context of the COVID-19 pandemic. We've certainly all been adapting and changing, and we want to hear from you how you've done that, what have been those barriers and challenges. And that'll be a discussion format. So we're going to be excited to have you off of your mute and in some breakout rooms so that you can interact with one another. Lastly, we have 3 presenters joining us under the banner of increasing adoption and sustained use. Really pleased to have Nikki Beach from the WHO, Mauricio Villagra from Water for People Nicaragua, and Ash Kumar Kaitu from the Environment and Public Health Organization of Nepal. So welcome everyone. Let's go ahead and get started. So it certainly has been a year in transition. The last time this network met was at the UNC conference back in October of 2019. I know my memory doesn't stretch all the way back to October, certainly March during our lockdown, and even watching the slow pandemic start to expand in January and February really sort of marks my memory quite strongly. But I do want us to think back over this last year, and I'd like you to share something exciting and positive that's happened in the last year that's been linked to the network or linked to water quality. And the way I'd like you to do that is to go back to that chat on your main page. So I'll actually pop out of this and you should be able to see the chat here. What's something exciting or positive that has happened in the last year in your professional world that you'd like to share with folks here as we start to interact with one another? Something that's related to water quality. So feel free to go ahead and put something into the chat. I'll admit it is a little different. I'm used to using the Zoom chat now, so using the Pathable chat is slightly different. I know I'm gonna refresh on mine. See if I can get some traction there. Oh, and mine's taking a little bit of time to refresh too. The HWTS network started in India, transitioned to a position with more research. Laura's excited about the network that they've started in India. Welcome, Laura. Welcome, Adele. Creating micro-learning tools on the topic of water quality testing. I guess I would encourage anyone to go in there at any time and share something exciting. Feel free to use that feature to converse. We'll be using it throughout the session. From my side, I'm really thrilled that CAWST has joined the WHO and the Water Institute to co-lead the HWTS network. We are really the three organizers of this network. We believe in promoting the network, its mission and activities to a global audience. And we want to ensure that that harmonizes across the network's goals. We're also very committed to disseminating the evidence base for HWTS and best practices in implementation as part of a range of water service delivery models. Water quality fits into all water service delivery models, and decentralized options like HWTS and point of use technologies can play a role in a variety of them. It's certainly not the solution all the time, but this particular group wants to focus on where they fit and are going to make the greatest impact. So really the year in review from the network's perspective has been transitioning those roles and responsibilities. I also want to acknowledge that over the past few years, the network maybe has lost some momentum, and we really hope as a team that we're able to reinvigorate it so that it continues to drive towards universal access to safe drinking water. We want this to be a vibrant network of knowledge exchange and promotion within the sector. So let's get started in terms of our first main section of the agenda for this morning. We'd like to talk a little bit about HWTS initiatives during the COVID-19 pandemic. We've certainly adapted in some ways, and maybe in other ways have found it quite challenging to adapt to this new environment. Some of the things that I've heard that have happened for practitioners are, of course, that move to virtual. I've heard of some organizations doing virtual monitoring visits of technologies in order to check the operating parameters and support users. I've seen others that are moving, of course, to online and virtual training and capacity building to protect their staff and their well-being and reduce in-person interactions. I've also heard that some organizations have struggled to reconfigure their programs. There were perhaps too many barriers in place to be able to meaningfully shift at this point in time. And on the other hand, where we might have expected sales to drop in water treatment technologies and products because people are focused on other essential needs for their homes and their households. That there are, for example, an organization that works in Kenya that actually saw their product sales increase during the course of the pandemic. So there really is no one experience of every single individual or organization that's working on HWTS and water quality initiatives. And we want to be able to capture and for you to be able to share the variety of experiences that you've had in different contexts, as well as within the different roles that we all play and how in what role we play in HWTS. So we're going to do a little experiment to use the breakout rooms. I know I was not, if you were here yesterday, I wasn't in any sessions that used breakout rooms, but we do have separate rooms attached. And for those of you familiar with Zoom, it is a little bit different because you are going to go back to your main page in order to select a room. So you're going to leave us here in the main room. Imagine you're walking down the hallway and you're going to head into another room. So we have 5 breakout rooms. The conversation will be the same in all of them. You'll have the same question of sharing lessons learned and challenges that you've experienced related to your water quality initiatives. So we have 4 breakout rooms. I'm going to ask you to self-select and go into the room based on the month of your birthday. So breakout room 1, if you were born in January, February, or March, you can join that one. Breakout room 2, April, May, or June. Breakout room 3, July, August, or September, and breakout room 4, October, November, or December. We also have one of our rooms running Sala Cinco with a conversation in Spanish, con Eva Manzano. So if you'd like to have this discussion in Spanish, then I invite you to join Eva in that room. So just to give you that look again, head on in down here. When you go back to the main room, you're going to go ahead and go into one of these breakout rooms for about 20 minutes, and then we'll invite you and we'll help you transition back into this main room. This room will stay open. So if you're having trouble, then let us know and we'll help you get to where you need to be. Thanks, everyone. Do see some of the rooms. I can see rooms 1, 2, and 4 are live. You may still be getting those other rooms up and running. Just double check here. Yep. Yeah, so go ahead and leave us here. We hope to see you on the other side in a breakout room. All right. I think a few folks might be, are you waiting for the other rooms to look like they're live? All right.
Hi, I'm having trouble seeing where I can join the breakout rooms. Where is that button on my?
So if you go back to your main page on the UNC website in your web browser.
Oh, you go and click on it.
If you scroll down to the very bottom, you'll see all the rooms listed there.
Oh, of course.
And you do have to close out of this Zoom window to be able to open another one.
Okay, thank you so much.
No problem.
If you are remaining in the room and you have a question, we have changed the settings so you can unmute yourself and ask a question.
Melinda, this is Nikki. I promptly, Elizabeth, am I in the correct room?
For you're supposed to be Nikki. You're supposed to be in the JMP updates. No, I'm sorry. I'm not
No,
sure.
room 3.
Oh no, you're back in the main room right now.
You're back in the main room. So go out and click on that close this window and then go into the HWTS room 3.
And you have to
Okay.
scroll down to the bottom.
I thought I did that. I'm sorry. You just told me how to do this too. I apologize.
No worries.
Mark Sopsey here, and I'm not able to get to HWTS room 3. Where do you get to it?
If you look back at the session page that you joined this one from and you scroll down, you'll have to close this Zoom call. You'll have to close out of this call, go back to the session page, scroll down, find the breakout, click on it. It'll open a new page and you join there.
Okay, thank you. Bye.
Bye-bye.
Okay, I'm gonna go pop into rooms.
All right, I'll stay right here and be ready to answer questions.
Anyone else have any questions about getting into the breakout rooms?
Yes, Isa.
Looks like
Hi,
you're
Lily.
you're joining.
Well, I'm part of the program, but
Okay.
I'm trying to figure out, I'm supposed to get the room 2.
So
So,
you go right ahead, Aisha.
all right, so you're gonna leave this Zoom meeting and go back to your UNC where you signed on to the meeting for the HWTS network meeting. And if you scroll to the bottom, you'll see the breakout rooms. If you'd like, I'll share my screen so you can see it from,
Yes, I got it.
which might be helpful. We'll give 2 seconds here. So this should be your main page here with the meeting. And so if you scroll down here, here is listed is all the breakout rooms. So you're gonna leave this Zoom meeting and then join one of these
Here,
rooms.
there's room 2. So here, so maybe I'm there already.
Yeah, it says you're there.
But who's in my room?
No, I can't get it now.
So you have to have this window closed before you can open another Zoom window.
Yeah,
So
how to close the window?
if you go down to the bottom corner of the screen, there should be a red button that says end. You may have to put your cursor.
That is leave.
Yes, you have
Yeah,
to
it
leave
is.
this meeting.
It is leave.
Yeah.
Okay, then I go back to this one again. Join and
Yeah.
again I'm coming.
Yes, but that'll be in about 40 minutes or so. So there's a bit of time. Did anyone else have any questions of getting into the breakout rooms?
Yes, I have Isa. So I
there.
could not enter the breakout room.
No, when I rejoined the same room again. There is no the main window is not coming.
Okay, so
I
after,
left this room.
oh, you left this room. Okay, so try leaving again and then try entering a different room from what you had just tried to join.
No, when I see join the meeting, I'm joining you again. As I've tried for third time now.
So you'll need to scroll down to the bottom of the page and click on one of the rooms down there, and it will open a new page for you.
No, I'm not getting this. I'm not getting this window.
All right, this
Okay,
is
I will
the
try again. I will try. Yeah.
All right.
Sounds good.
I apologize, but I'm not sure I'm in the right place either.
No problem. Nikki, which room did you try to join?
3.
Try 3. Try going to another room and see if that works.
Okay.
It's not anything on my screen.
Aisha, am I supposed to click one of the rooms at the bottom of the screen?
Yeah,
Is that it?
yeah. Hey, Sam, so we just did the opening presentation and now everyone's in breakout rooms. So you can join any of the breakout rooms listed below.
I think my browser might not be working. So when I click one of the rooms, it just sends me to a white page that has no real. Yeah.
Which room did you try to join?
I tried one. Should I try another one? 3 or 4?
Maybe just try another one and see if it lets you in there.
Sam, did you leave this meeting before you tried to click on the other one?
No. So I'm
No,
gonna
so
do
you
that.
have to leave this meeting, otherwise it won't work. Yeah.
Okay. All right. I'll do that. Okay. Thank you. Sorry.
No worries.
I just got here. I had to register and all of that.
No worries.
All right. Thank you.
Nikki, so it may be that you may need to refresh your screen. That may be a problem. But I'm not sure. If when
I'm
you
back.
scroll,
I'm back again.
As am I. Let's see.
I'm coming back to this room only. I'm not getting the original screen.
so when you are you seeing my screen? When you scroll down to the bottom of the HWTS session, you're clicking on one of the breakout
No,
rooms.
this.
Yes.
Yeah, breakout room screen. I'm not getting, madam.
All right, it's just so this is where you joined the meeting we're in right now. If you close your Zoom window, come back to this HWTS annual meeting and scroll down and pick one of the breakouts, it should open a new window. You need to wait till the new window opens. It says the breakout name and then join there. Is that what you did, Nikki?
I thought I did, but I will try again. Yeah, and I tried a different.
Okay.
Okay. I'll give it another try.
It may be that the system's having problems, so we'd need to know that. Looks like
Okay.
Mark's back too.
Okay. Let me try again in case I didn't do that. I think I did though.
Mark, are you having problems getting into breakout? Oh, you're muted.
You're on mute.
Yes, I'm still having problems getting into the breakout. The system is very slow and it's not clear. When I pulled it up, all I got was the chat part of it, and I could not actually engage.
So when you clicked on a room and did it change like that?
It changed like that, and then I clicked join meeting, and then nothing.
And it came back in here?
I got an error message. I got an error. There was an error message on the screen that didn't look like the meeting itself. So when I clicked on that, it just didn't work.
Try refreshing the screen and see and try again. We may be overloading their system, but
and maybe try a different room from which number you had tried previously. Maybe the room you're in was a bit full.
So I
tried room 3 and it wasn't that crowded according to the number of people who were shown on the list of participants. Maybe had 6 people in it.
So I just gave it a try, and what I found is clicking the button for the room didn't get me right into the room. I clicked the button and then it had a button up above that said reserve spot.
I clicked that.
You did. And then after reserve spot, above that, another button opened that said join meeting above that. Okay.
Yeah, I clicked that and I did not get to the actual meeting location. So I don't know why this system's not working, but it's not working for me.
I apologize for the challenges. If you want to give it another try, and I'll let them. I'll report it to Pathable. Let them know we're having problems.
Yeah, it's not a very user-friendly system in my experience so far. Sorry. Let you know.
And just make sure to refresh your page before you try again.
All right, will do. Thank you.
Hi, Hank, you look new to the room. If you'd like, we're in breakout rooms at the moment. So if you want to leave this meeting that we're currently in and go back to your main page for this session, if you scroll down to the bottom, you'll see a number of breakout rooms. If you want to join one of those, that's where the session is right now.
So you'll need to close out from this Zoom meeting and go click on a breakout room. It should take you to a new page with a join button, and you can join your breakout room there. And they just divided them up on based on birthday. So pick any month, and the last one is Spanish language.
But the WHS meeting is in the room 1 now, is it?
They have divided into little work groups or breakouts.
Oh, okay.
And then they'll be coming back into this room to have a couple presentations.
Okay. And which is about dissemination of household water treatment?
They all are. They're just smaller working groups, so you can leave this
Any
meeting
group
and join anyone.
is okay. Okay,
Yes.
thank you.
No worries, enjoy. For all of those still left in this room, I will let you know that the breakout rooms will take about 40 minutes. So we do highly encourage you to join the breakout rooms, as that'll be the majority of the session. Please let us know if you have any questions or issues getting into the rooms.
The one labeled attendee is my second computer, so that one's me.
Okay, perfect.
From all of the people that are working the monitoring and evaluation, it has been really challenging, this part. There are also some comments from the private sector, like there are changes how we test, how people are testing the technologies. They're changing some of the way that they're testing technologies. COVID has also caused other impacts in communities, like phone number change, which complicates measurement activities, carbon credit allocation, all things like that. And from also another private sector, the community, the way that the community filters has been implemented, they are considering switch to foot operated taps to reduce contamination risk. So they are changing the way that the taps work, they operate. So there are so many different ways to now to deliver the services and the technologies into the communities with different ways in order to avoid the contamination. So there are like so many discussion also, like is that increasing the demand for technologies, or just the people are getting more aware of the importance to treat water? Some of companies or even the NGOs haven't seen any increase, but some of them has it. So it was like a balance between some of them has increased, some of them has not. So yeah, it was a great discussion between all of us, and it was really good to hear.
Thanks, Marcio.
Yeah.
And I think your last point really highlights the fact that the experiences are so different, where you've seen an increase in some products and decreases in others, really is so context specific. Thank you. Let's move on to breakout room 2. Lena, join us, and yeah, go ahead.
I'm going to echo what Marcio said, and that the discussion was incredibly rich and so interesting to hear from people who are implementing, how their programs have been impacted. And I won't focus so much on the impact, because it's fairly similar, I think, to what Marcio said. people just being unable to travel, trying to struggle to find ways to continue their programs from a distance, and in some cases just totally losing contact with the on-the-ground team and not able to pick that back up again. But what I really want to focus on, and from our discussion, is the opportunities that people highlighted that they're seeing come out of this. A couple of them mentioned, the ability to transition to online communication means or training for their on-the-ground implementation teams. Also, some are seeing actually an increase in demand for the products that they're supplying because it's a pandemic and people see the value of that, whether it's chlorine or ceramic filters. And then the really interesting one is that in some cases it has sped up the transition to local ownership of the programs. And I think that's a really fascinating opportunity that's come out of this, because the intention often in many implementation programs, particularly when they start from North America or Europe or somewhere in the West, the intention is that transition to local ownership. So sometimes a crisis just speeds that up a bit for us.
Yeah, it sort of puts those conditions in place where you have to step back and step away, and that can be a really good thing. Yeah.
And I just want to point out that this is my Halloween costume. I'm not just dressed ridiculously. I'm dressed as polka dots today.
At CAWST, we're having Halloween week. Keep the energy up. Thanks, Lena. Sunil, we'd love to hear about your conversation. Oh, so go ahead and unmute yourself. There's so many faces, I can't see you. And if we've lost you, then I'll move on and we'll come back to you. Okay, I'm going to come back to you, Sunil. So Lisa, why don't you go ahead and unmute yourself?
Sure. Can you hear me now?
Yes.
Perfect. So I think we had very similar themes in our conversation. The thing that implementers talked about is that challenge when things first came into lockdown of how do they continue to reach communities. In Honduras, they were doing it a lot with working with teachers, of connecting virtually to them, and found challenges in terms of the different technologies that teachers had available to them with regards to whether they had support with, if they had cell phones or computers or no access to that technology at all. In India, they did online as well, but they also reached out through telephone to their client group and were able to do capacity development education in that way. And in places like Kenya, they were still able to do a lot of they were still able to do household visits, but were no longer able to do community, sort of the once a month community meetings. So people were adapting their implementation a lot in this context. The other thing that came through very clearly with a lot of the researchers that were in our room were the challenges related to field research. Many people are no longer able to do the field research and they've had to adapt. One person in Canada, instead of doing the field research in the countries they had imagined, they were now having to do it with backpackers that were and testing household water treatment devices that they would be using in that context. So people making interesting changes, and then other challenges because many labs have switched from doing the water testing and household water treatment testing with regards to household water treatment to have to switch to doing a lot of tests related to COVID, and no longer an availability of, say, undergraduate students to support with that research. So people being innovative in terms of how they can get the research done in that context of not being able to do the field work, not having the lab space that they would normally have, or sometimes the products available to them that they would need to do that testing. So lots of innovation all around from different, both in the implementation and on the research side.
Yeah, I think that highlight of creativity and how do you try something new that, in this type of circumstance gives you the opportunity to try something you haven't done and be creative in that. Mm-hmm. Thanks, Lisa. I'm going to move on to Eva Manzano. Eva, if you want to join us.
Hi, yes, sorry. I was just typing things on the chat, so many things going on at once.
Yeah, tell us about your conversation.
Yeah, so from our group, I think most of the things were mentioned, obviously, like the challenge of traveling, and like in most Latin America, in most countries, like the lockdown made like operations to shut down completely for the initial months of the pandemic. But fortunately, like organizations have been like adapting the programs and like using the virtual means for reaching their communities. So there has been lots of good learning around that. Like one of the things that it was mentioned, it was also like the emphasis that the COVID and the hand washing promotion and behavior change has put this wash sector in a way better position in terms of getting attention from like donors, governments, etc. Because even though like we talk about hand washing, like having water to do it is very important. In most countries that was the case, but there were other cases where they actually were able to keep doing more or less activities during the pandemic with no problem. But something that it was also very interesting to hear, it was like the opportunities. There has been lots of adapting to providing virtual support, like through training, phone calls, etc. But one of the things that kind of stay with me as one of the key points that was mentioned already by other group, it was the fact of supporting the communities and build that ownership on the projects. So reinforcing that community role, that it's so important for the sustainability of the programs. And sometimes now it became like even more important, knowing that we couldn't have access the communities. And yeah, like one of the questions that is still in the mind of many of the team members was like how we can still not forget that in the remote areas, like they don't have access to virtual platforms. So how we can keep that training sessions and that communal space as an important way of engaging communities and making them part of the project. So that's something that we still need to figure.
Yeah, and I think that does raise the question, are we increasing inequalities through this pandemic, which I think we are seeing. And that's just one of the many inequalities that is exacerbated, I think, in terms of really focusing on those that are more remote, distant, not as connected. So certainly something that we need to focus on in the recovery. I'd like to invite Sunil to unmute himself again. I was trying to scroll through all of your wonderful faces. I think he might have lost his connection.
No, I'm there. I'm
okay.
there, but I don't know. Bring me into the presenter screen.
Oh,
yeah. So,
thanks.
yeah.
Go ahead, Sunil.
Yeah, thank you very much. We had very interesting discussions, but one of the common threads is people were working remotely, either remote data collection by the researchers, remote monitoring and remote support by implementers, such as Sehgal Foundation in India. And Claude from PNG mentioned that during the initial lockdown, they stopped a little bit for supplying the products, but as soon as lockdown is lifted, with the PPEs and increased hand washing facilities, they were able to provide supplies, travel to their beneficiaries. But still there was an issue, local travel in some countries. But at the same time, in some countries, early restrictions were removed very early, and then they were able to travel as well. And one of the another researchers who was doing water quality testing in a lab, she mentioned that Linide, with carpooling with colleagues, they were able to go by wearing PPE, go to the sites to collect the wastewater collection and bring back and do the testing in the lab. So people have found a way using PPEs and providing remote support to carry on with their activities.
Thanks, Sunil. Yeah, I think that focus on safety has been really important to get those protocols in place. And that's certainly an area where I would say CAWST focused a lot of time with supporting partners and clients in terms of how do we do this safely to minimize risk to staff as well as risk to communities and places where you're working. Thank you, everyone. Thank you for engaging us in a conversation and helping to paint that picture of the variety of our experiences. I think that we obviously are continuing to learn because we're still in the midst of the pandemic and will be forever changed because of it. But hopefully this is a chance for us to share those creative ideas with one another going forward too, as to how what can be adapted and maybe what is paused and put on hold. So that closes the first part of our session, and we're going to move into the second part of our session around increasing adoption and sustained use of HWTS. Correct, consistent, and continued use has been a focus of this network for a long time, with the recognition that really we need to be drinking safe water all the time. Unfortunately, one glass of contaminated water with enough pathogen can make us sick with something. So this network really has focused on how do we support and create the conditions for this to happen. So we have 3 presenters under this overarching theme. And as we're going through, I want you to invite you to write your questions for the presenters in the chat. One of our team is going to be reviewing those questions, and then at the end we'll be selecting one for each of the presenters. So please go ahead and write those questions in the chat as they're presenting, and we'll be reviewing those. So we're going to start off this morning with an update on the WHO International Scheme to evaluate household water treatment technologies. I want to welcome Nikki Beach. She's seconded from NSF International to the World Health Organization to provide support for the WHO scheme to evaluate household water treatment technologies. Nikki has been working with water treatment technologies for almost 20 years and has been supporting the scheme since 2011. So thank you, Nikki. Welcome.
Thanks, Melinda. Can you hear me okay?
Yeah, I can hear you great.
Oh, okay, super. If you want to move to the first slide there. Thanks. I'm thrilled to give an update on the WHO scheme to evaluate household water treatment technologies, or the scheme, including an update on where we are with round 3. If you want to go to the next slide. And I do want to say, you know, correct and consistent usage is very important, and the scheme does not, you know, forget the value of that. But also pulling in with the scheme, right, with this presentation and this update, is this idea of we want to make sure we're selecting products that also perform as intended and for your needs. And so last year, 2019, we published the results from the round 2. And with round 1 and round 2 completed, we now have 30 products that have been evaluated under the WHO scheme, which is great. We want a nice big list there so that folks can make an informed selection around products that work from a large set of products. And what we've learned to date with those 30 products is that about 20% of those, or 6 of the 30, did fail to meet the minimum performance criteria. And interestingly enough, 4 of those 6 that did fail to meet minimum performance criteria were not really due to design, but were due to weak manufacturing quality control. So that was an interesting discovery. We also learned that we need to continue to stay close to the evaluation protocols and make sure that they're appropriate. We want them to be adequately rigorous, to be protective, but also be you know, reflective of actual household conditions. And there's going to be the need for continued efforts for reduction in the cost for the performance evaluations and their complexity to ensure sustainability of the scheme. So with that, we're now in the middle of reviewing and finalizing 18 products under round 3. If you want to go to the next slide, which is exciting because when we add those 18 products, we'll now be approaching 50 products that have been evaluated under the scheme. And some round 3 important mentions, some things that are a little bit different with this round. One is we move to a rolling admission. And what that means is in the previous rounds, we mostly waited till we received a large number of expression of interest during a period of open receiving period for expression of interest, identified which ones will be evaluated, and then allocated those to the designated testing facilities. Now with this round, what we did was as they came in, we evaluated the expressions of interest for inclusion. And then if they met criteria, we moved them to a designated testing facility so that they could begin the evaluation even before having the full complement of the rounds submissions in. So what this did is allowed us to make better use of our laboratory capacity, move things quicker. And the goal also is to be able to come out with more frequent reporting around the rounds. We continued to do protocol refinements, as I mentioned, so ongoing research to improve evaluations. In round 2, we spent a lot of energy taking a look at the chlorine and other disinfectant protocols that were being used and refining those. And round 3 saw onboarding of some additional support to assist with looking at the market to see if there are some products that are moving in the market that would be good candidates under the scheme to do some outreach with making them aware of the scheme and bringing those under the scheme, as well as building national technical capacity efforts. Next slide, please. So as I mentioned, we have 18 products in round 3. And so the interest in the WHO scheme remains very strong, not only with manufacturers, but the other stakeholders, the regulators, the NGOs, folks who would use this list as we develop it. And with this round, the priorities remain the same, which is build on that number of product evaluations again. So there's a long list to select from, different technologies, different ways they can be applied to suit the different situations. Continue to strengthen national capacity, both technical and regulatory, and increase the impact of the scheme, including overall lab capacities for water quality management. Look to support linkages with the wider health interventions. There's been some work put into connecting WASH in healthcare facilities with the scheme, bringing that awareness to those spaces. And then, as I mentioned on earlier slides, just this continual update, taking a look at our protocols, our evaluation process for their appropriateness. Are they adequately protective? And for sustainability, what can we do to maybe bring down those costs and complexities so that they can be affordable as well as maybe executable in country. So again, this talks a lot about performance, which is an important component, but also not losing sight of we want to make sure things are consistently and correctly used. So thank you. That's the update.
Thanks, Nikki. I really appreciate the work that you've done in terms of moving towards more of that rolling admission to try and see some of that, as well as outreach to current products. And the focus on connecting with the broader sector, WASH and healthcare facilities, and the recognition that it's not just the household, it's everywhere that we need safe drinking water.
Right. Thank you.
Thanks, Nikki. Next, and so just a reminder, if you have questions for Nikki, go ahead and put them in the chat now. And we're going to move on to a presentation about fitting HWTS within the Nicaraguan government strategy to reach health authorities. So it's my pleasure to introduce Mauricio Villagra, who is the interim country director for Water for People Nicaragua. He also leads the Nicaraguan Water and Sanitation Network, ROSNIC. He is an experienced business and financial professional with 10 years of experience implementing WASH programs with Water for People, bringing expertise in microfinance, monitoring and evaluation, sanitation markets, and local stakeholder capacity building. So with that, I'd like to introduce Mauricio. Welcome.
Thank you. Thank you so much, Linda. And hello everybody. And yeah, really thank you so much for the introduction. Can you go to the next slide, please? So in Nicaragua, we have established an interinstitutional committee for advancing toward SDG 6. Main government institutions that are part in this committee are the Water and Sanitation Institute, who leads this committee, also the Ministry of Health, the Ministry of Education, and all the institutions related to WASH sector in the country. HWTS have been recognized as an important alternative to reach underserved population in the country, but there is a general lack of knowledge on the most appropriate options for different contexts. So that's why CAWST and WaterAid initially planned to deliver in-person training targeting health workers to extrain their knowledge about HWTS options and what to consider on their implementation. However, the pandemic ruined this plan and we have to look for other options. And that's when the Water and Sanitation Network in Nicaragua and the government got involved, and we were proposed to deliver an online version of this training. So we decided to start with capacity building process by targeting health authorities, as they are responsible for the water quality surveillance and health promotion, and also they play a key role in the promotion such options. Could you go to the next slide, please? For this training, the invitation was sent to over 170 people, mainly from Ministry of Health and FICE, the institution responsible of water and sanitation in rural areas here in Nicaragua. There were several of them that couldn't commit that time, but so far there are more than 120 that keep on this course. And also we are planning on scaling this training to other audiences in the next year. So that will include the audiences that you have or you can see on this slide, and we are going to share the results with you next year. Can you go, please? Can you change? Here you can see how this course look like. CAWST e-learning resources on HWTS were crucial for development of this online course because there are short, online, and interactive modules that allow getting the basic concepts on HWTS options and implementation. And also, all these modules are available online at open source website and are available in English, French, and Spanish. Next slide, please. The module were articulated in an online course using an learning software management tool, which allow complement the modules with additional learning aids. It also includes space for discussion and questions and assessment form in order to check the knowledge that they gained. And additionally, to keep participants engaged, live webinars were organized to support participants with answering their doubts and reinforce key messages. The online course will finish with the project proposal where participants will provide HWTS options for a community in Nicaragua that lack access to water. And so we know that virtually still has certain limitation, and we will invite participants to attend to the Smart Center here in Managua at the end of the course in order to see the technologies available in the country, and also they are going to be able to know more about pricing and local implementation. So thank you so much.
Thanks, Mauricio. I love your ambition and plans for the future as well, but I also really appreciate how this is really connected to the government policy and the network and meeting the needs of populations that are underserved.
Yeah.
Thank you. Next, I'd like to invite Mr. Ash Kumar Kaitu to join us to talk about increasing the use of HWTS in Nepal using a behavior-centered design approach. Ashkumar Kaitu began his professional career as a social mobilizer and now heads the training center of the Environment and Public Health Organization, ENFO, with field-based experience to change behavior of communities through knowledge and skill building. With more than a decade of experience in WASH, he brings diverse knowledge from project planning, management, implementation, education program development. And since 2015, he's been especially involved in demand creation for products and services and behavior change in the aftermath and recovery of the Nepal earthquake. So I want to invite Ash Kumar to unmute himself. There you are. Welcome.
Thank you, Melinda. Hello, good evening, everyone. I'm very glad to be here to share my experience on how we are increasing demand for household water treatment option using behavior center design approach. Please, next slide. So we all know that this water is life, but it should be safe. And when we talk about the behavior change, it's not an easy job. It's very time-taking things. That's why, so we link up with HWTS with the behavior change approach. That's why, so for when we talk about the behavior change, it should be very specific. So we went with this slogan, I take no chance with water, with my child health. So we are linking with health perspective. Please, next slide. So first of all, so behavior change, not easy things. That's why, so we took help from well-established approach. So that is the approach developed by London School of Hygiene and Tropical Medicine. We use that approach to promote household water treatment option in Nepal. So basically, we implemented that approach in earthquake-affected 5 districts with the help of local organization. So first of all, I would like to slightly explain about what is the behavior change, behavior center design approach. So you can see the diagram here. So we can call it ABCDE approach also. So because A means access, B means build. So first of all, we should know and collect the information from the targeted community. Based on that information, we have to create new messages, behavior change messages, and based on that messages, we deliver effectively. And obviously, if we deliver effectively, we will get the best result. That called evaluation also. I just want to relate this graph in the activities what we conducted. So first of all, so no audience means no audience and drive motives. So that we did through the formative research, and it goes to access and build component of this approach. So after that knowledge, based on that knowledge, we designed promotional material and we tested that material in the community, real community, because while we talk about the behavior change, it should be tested, means all the equipment, all the materials should be tested before going to the widely. That's why, so we tested those materials also, and based on that materials, we revised and implemented that approach in a way. So, in this way, so we implemented behavior center design approach, linking with household water promotion. Next slide, please. So what we did during the implementation, we already discussed about the ABCDE approach, and we talked about ABC, up to ABC. Now we are going to talk about the delivering, that means D for delivering. So what we conducted, what we did to deliver those activities. So first of all, we find out the touch points, means the means of communication, how we can reach the targeted persons, targeted community, and train the resources accordingly. So for example, we decided means many touch points. Touch points means platforms like mothers group meetings, like local FM stations, like other informal meetings. So we decided that touch points, and based on that, we trained those triggerers or motivators who will go through that meeting and provide this kind of message. So after training, providing the equipped training them. So another things we did, that is providing necessary equipment, materials to keep them, because we are sending those for fighting to change behavior of community people to consume safe drinking water. That's why, so we train them in that way and provided toolkit, tablets, ice materials with all the resources that should be that is necessary to convince people to change their behavior and provide a example, something like that. And we mobilized all the 40 triggers at a time in all 5 districts with the supervision of 5 coordinators, and time to time we motivate them, we supervise them. So basically we solve their practical issues, we help them to get more support, market linkage, all these things we supported them to conduct that kind of activities at the community level. Next slide, please. Because of all this effort, then we started to get results. So actually we were targeting 75,000 households within a 8 month to change their behaviors on using safe water. So unfortunately, it stopped in between. But however, we succeeded to reach 52% of targeted households with the message of safe drinking water, how they can use safe drinking water. And the good thing is, altogether, the 60% households of reached household, they are still using household water treatment option in these days, which is very good. And we triangulate this data. Basically, so this data we received from the triggers or motivators, and we triangulate this data through our phone calls because of this COVID scenario. So we could not go in the household level, and that's why we checked with phone calls, and we found the accuracy of that data, means what they reported. We got more than 80% households we were using. We found they were using the household treatment options. That was so exciting things, encouraging things for us. But unfortunately, in this movement, this campaign was halted in between. So you can see the progress month-wise in the diagram. December, so it was increased by 6,000 households. So there was a big jump in January. So it was almost 13,000, and the bigger change was in February. So it was getting motion. It was getting more changes in the community. So we got more than 20,000 households, but unfortunately it stopped during between the March, and we achieved around 23,000 households within this 4 months with intensive implementation of this behavior change campaign. Next slide, please. So this was short span of time, means it was not long time. So we just got 4 months to implement our activities. However, we learned so many things. So for example, so when we talk about the behavior change, so our learning is, let's focus on only one message at a time to keep short, clear, and simple. And that makes change. So we got that changes because of this clarity, the shortness. Another learning is, so let's communicate same message through different means and media, so that people feel like, okay, I'm hearing here, I'm hearing there, same message. So it's like a same message, but multiple shows. It's like a reminder for households, reminder for people to adopt that behavior frequently. And there is saying like that. So if we just provide one single message, that is not enough to change their behavior. So once we provide frequent messages through various means and media, we will obviously get some change in the people's behavior also. That's why, so that was another learning from our side. And another one is, so obviously, balance between demand and supply. If there is demand but no supply, then we cannot expect behavior change. in a vice versa. If there is supply but there is no demand, there is nothing going to happen. That's why so we should be very clear, cautious about keeping balance between demand and supply of product to change the related behavior of community people. That was our learnings from that campaign. And if somebody wants to replicate that approach in their project area, so we would like to strongly recommend these 3 points so that they can get more success. So first one is motivate workforce frequently. So obviously we cannot go through, obviously we have to mobilize some workforce to take that message and convey it with community people to change their behavior. And sometimes what happens, we just provide single message and send them and ask them, okay, convey this message to community people and change the behavior, which is not actually happening, because behavior change is still, it's practical things. It's not easy. And they may face different problems, different issues. That's why so they may demotivate in between also. So one of the recommendation from our side is let's motivate workforce frequently, provide them tips, suggestions, or ideas to solve with the practical issues that will keep them motivated and motivate them to do more and more. Another recommendation from our side is follow-up. Behavior change is not single, we cannot achieve that in a single attempt. And for that, we should follow up, we should provide reminder, follow-up call or follow-up visit to remind them to adopt that behavior. That's why so either visit or call, we have to remind them frequently. So we used different means and media for that. And again, we are recommending that. So follow-up is very essential. So we implement that approach in a campaign way, but it can be in a program way also. So there is 2 things we can do. However, we implemented that in the campaign way. So campaign means short time and more results. And the last recommendation from our side is keep patience, because it's not going to happen next day. And for that, we should be prepared that it will take more time and we have to do something more. If we don't keep that kind of things in our mind, so we may demotivate quickly and we may drop that idea. That's why so our last recommendation from our side is keep patience, because it's taking time. Thank you.
Thank you, Ash Kumar. It's true. Good work takes time. Behavior takes a long time to change in some cases. Sometimes it can be quick. We are going to skip the question and answer. I'm sorry about that. But if you did put questions in, we'll do our best to link people after the chat. This room will close in just a couple minutes. So I'm going to move forward and just say, as a network, we've put in some new platforms and systems to keep you all engaged and to help us connect with one another and support one another and share good evidence and practice and have that lead to our goal of improving water quality. So visit our website to sign up to become a member. You can email us, you can follow us on Twitter. We did just launch a discussion forum on Knowledge Point. So join us. You don't have to be a member to join the discussion, but feel free. That's one platform we'll be using to increase member engagement, to share information with one another. So please come and join us there as well. We will be ramping up our first kind of engagement topic coming up around markets and HWTS. So look for some more information coming your way in November. Again, I want to thank all the presenters, all of my breakout facilitators, people working on the back end, and UNC for making this free and virtual this year. I have really appreciated seeing lots of faces I've seen before and lots of new faces and names. So thank you. And I hope you enjoy the rest of the conference if you're attending. Thanks, everyone. Take care.